Prathima Group of Hospitals Directors, Dr. Harini Garu, for this CME, which is organized by Department of Medicine, Academics and Medical Services, the Prathima Group of Hospitals, Kachiguda unit. From now onwards, as a part of our earlier discussion, we will continue our academic activities in this unit to enrich our knowledge as well as to establish clinical standards and quality healthcare services in the unit. I thank Dr. Harini Madam for giving me an opportunity to get associated with you all and work for the organization. I extend my sincere thanks to Dr. Sridhar, who has introduced me to this organization, and I also thank all the consultants and unit heads and HODs for your continuous support and cooperation. Before starting our CME, I request Harini Madam to just address the gathering.
Good afternoon, everybody, all the doctors, outside doctors and the media. Thank you for being here. I'm very happy to inaugurate this auditorium, Prathima Medicconnect. I think it's a symbol of our commitment towards medical excellence, innovation and collaboration. Here we would like to bring in minds where we can heal, inspire and also lead the change in the healthcare. I thank all our team members who made this idea into a reality, especially Dr. Haricharan sir, his team, medical administrators, Jagdish and Sridhar, and all the supporting staff. Thank you so much for making this a success. Congratulations to you all. I think we'll do many more like this. And we are not just opening the doors for the auditorium, we are opening doors for endless knowledge, learning, knowledge sharing, and strengthening our medical community. So I would like to thank the media for coming here and supporting us, and all the outside doctors. Thank you for being here. And at Prathima, we are deeply committed to providing good healthcare to the society. We've been doing this and will continue to do this, and let us all grow together. Thank you.
Today's topic is adult immunization, empowering immunity and enhancing longevity. So before starting this adult immunization schedule topic, I will just introduce about the immunity and what are the types of immunity which we have, and when the adult vaccinations to be given, and how many doses to be given, and everything will be explained by the next speaker, Dr. Supriya Rao, MD Internal Medicine, Consultant Physician. Coming to the introduction of the topic, what is immunity? Basically, what is immunity? Because we all know it's a defense mechanism. One's own body produces the antibody to protect itself against a preventable diseases. Is defined as defense mechanism, otherwise known as immunity. So we have basically two types of immunity: active immunity and passive immunity. Active immunity means antibody produced in the same body give protection to that particular body. So that is active immunity. Active immunity basically humoral B cell type immunity, cellular type immunity, and sometimes overlapping of both. B cell means bone marrow derived, cellular is T cell type, that is a thymus derived immunity, and sometimes overlapping of both B cell as well as T cell type. Coming to the passive immunity, antibody produced in one body is transferred to another body and give protection to that particular body. That means for the protection against a preventable diseases, someone should depend on the other's body antibodies. Nothing but a ready-made antibodies given for the protection. They are like immunoglobulins, anti-sera and all these things. So what are those immunizing agents? Coming to the immunizing agents, we have vaccines, anti-sera, as well as the immunoglobulins. So now adult immunization, this vaccine is most important. So what is vaccine? Vaccines are like, for the past decades, vaccines are the most effective medical strategy for giving protection against the preventable diseases. So vaccines, almost all of you know that smallpox vaccine, so which was first identified in the year 1798, and now smallpox worldwide eradicated, and poliomyelitis also almost eradicated worldwide. So these are the vaccine strategy. And coming to the vaccination, every year 2 to 3 million lives saved due to the vaccination in the year. So vaccines are most important, and we all know that vaccines are given to the children, but we should know vaccines are given to the adults also above 18 years. So when to give, how many doses to be given, and to whom exactly which vaccine to be given and all will be better explained by the next speaker. So this is about the vaccination. So once again, I thank each and every one of you for coming here and participating in the CME. And I also thank once again Dr. Harini Madam for coming and gracing this occasion. Now I request Dr. Supriya to further continue the session. Thank you.
There is a myth stating that the vaccines are for the childhood or for the kids alone, but the immunity from the childhood vaccines may wean off over a period of time, and the adults post-travel or any chronic diseases, they have a high risk for any kind of infections. So these vaccines will protect the vulnerable groups from mainly the infants, elderly people, and the immunocompromised patients from the superimposed or any secondary infections. This also prevents the serious illnesses, and the rate of hospitalization will be decreased along with the number of deaths. In India 2023, according to WHO, there were about 2.3 million adult hospitalizations from the vaccine preventable diseases and about 45,000 deaths annually due to preventable infections. As I've told earlier, the myth about vaccines are only meant to be the kids is to be ruled out, saying that the adults also need the booster doses, and along with that, any new vaccine, if there's any infection, has to be administered to the population around. People think that they're quite healthy and they do not need any kind of vaccinations, but there is a saying that many kind of infections or anything would be priorly first infect the healthy individuals, and there is a saying of infections or side effects for post-vaccination, but the saying could be right, but to only a period of time. There would be mild fever or kind of a rash for a period of 2 days, which eventually a temporary period, saying that the vaccines could not be delayed or not to be taken. So it is an important fact that people here need to have an awareness for the vaccination schedule, which eventually prevents many kind of infectious diseases. So we'll here have a review of what are the essential adult vaccines. Influenza vaccine is recommended for all the adults, which has to be taken at a frequency of every year. Tdap vaccine has to be taken once started, followed by the TD vaccine with every 10-year booster dose. Human papilloma virus vaccination has to be taken up to age of 26 to 45 years with around a frequency of 2 to 3 doses. Shingles vaccine has to be taken above 50 years of age with a frequency of 2 doses, and pneumococcal vaccines which have 2 to 3 variants have to be taken between an age of 65 above or without, if it is less than 65 years, patients with comorbidities with a frequency of around 1 to 2. These doses can be adjusted based on the health condition, travel plans, along with the age-related issues. So, coming up with the influenza vaccine, which is also called a flu shot, any vaccine we need to have an idea about 3 aspects: when to be taken, why to be taken, and the effectiveness of the vaccine. So why is it important to take a flu shot? It is because it prevents the seasonal flu infections and any secondary complications to it. Along with that, it is very important for elderly patients, chronic patients, and pregnant women with a frontline workers, because they are highly exposed to the influenza. When is it to be taken? It is to be taken in between a month or in between September to November, which is also called as a flu season. And coming to the effectiveness of this is being estimated by multiple studies, stating that the hospitalizations were prevented in 2020 were about 1,05,000, and in the year 2021 were about 78,000, which clearly states a reduction of hospitalization post-flu shot is about 60%. Coming to Tdap virus, the diseases prevented by this are tetanus, diphtheria, and pertussis. It is a statement of pertussis vaccination which is being given about a month of 2 months, 4 months, 6, 18, 4 to 5 years of age along with 13 years. But after that period, usually people only take a vaccine of tetanus and diphtheria alone. But the thing that to be remembered is over a period of time, the immunity from the pertussis vaccine will also wane off. So the requirement of the Tdap booster dose every 10 years is compulsory. And coming to the pregnant woman, it has to be taken over a period of 27 to 36 weeks of gestational age in every pregnancy, as it prevents the newborns from any kind of maternal antibody transfer. Human papilloma virus vaccine. The importance of this is it prevents the cervical, anal, oral or genital cancers, and it is most effective before any sexual exposure but can be taken up to 45 years of age. Though it is said that the effectiveness of any HPV vaccine is more before the sexual exposure, it is better to give before a prior age group, because need for early age is because of protection long before once they are exposed, because once they are exposed to it, it takes a long period of time for it. Apart from the available vaccines we have right now is Cervarix, Gardasil and Gardasil 9. There is also a saying that there is always a question like why male need to take the HPV vaccination, because it can prevent any kind of future infections that leads to cancers, particularly the penile cancer and the anus cancer. The dosing guide is around 9 to 14 years with a frequency of 2 doses, around 15 years with a frequency of 3 doses, and between 26 to 45 years it has to be followed up by the physicians. Coming to the Shigel's vaccine. This is due to the reactivation of the childhood chickenpox virus. There were earlier as a live vaccine which is called Zostavax. Due to its low efficacy, it is no more available. But we do have a non-live recombinant vaccine which is called Shigeritz. It is being given around age of 50 years, and 2 doses are being given with 2 to 6 months apart. The effectiveness studied by the different studies states that 90% is preventable for Shigel's. Coming to the pneumococcal vaccines. Pneumococcal vaccines are effective against pneumonia, meningitis, any kind of bloodstream infections. The vaccines available outside are pneumococcal conjugate vaccine 15 or pneumococcal conjugate vaccine 20. The conjugate vaccine is always a better vaccine in comparison to the polysaccharide, because it has a stronger and a durable course in comparison to the polysaccharide. Polysaccharide is reliable up to an age of 2 years, not more than that, because it has a purified extract of a polysaccharide alone without any weak antigen from the carrier. So the vaccination strategies for these pneumococcal vaccines are, it is above 65 years and below 65 years along with the comorbidities. If it is given above 65 years, it has to be given either the conjugate vaccine along with the polysaccharide component once scheduled. In case of high risk individuals, it has to be given 1 year apart. Whereas in immunocompromised patients, it has to be given on a scale of sequential doses based on the physician guide. There are few special populations where vaccinations are always recommended. In case of pregnant women, it is always a Tdap vaccine and the flu shot in every pregnancy. In case of healthcare workers, it is hepatitis B, MMR vaccine, varicella, a flu shot and a COVID-19 virus. Where in case of a frequent travelers, it is yellow fever, typhoid, hepatitis A or B or rabies vaccine. In case of elderly patients, it is always flu, pneumococcal vaccines, Shigel's vaccine. In case of immunocompromised patients, it is always better to avoid live vaccines. In case of any HIV or a cancer patient, it is always better to consult a primary physician and followed up by the vaccination process. We have already discussed how and what are the vaccines to be taken, but is it always followed? No. We have to have a complete compliance to it by tracking up what is the vaccination pattern. So it is good to maintain a personal vaccine record, be it in the digital form or in the form of a paper. It is better to follow few apps which are like CoWIN, CCD, CDC and Immunize. Along with that, discussing the vaccines annually with a consultant that are in follow-up is always better. And joining a workplace or a community for vaccination drives is also good. The tools that can be followed up are the CDC Adult Vaccination Assessment Tool, which is available in everybody's phone in short. So coming up for the key takeaways for this conclusion points are: the adult vaccination should never be neglected and always essential for the long-term health benefits. This would prevent avoidable deaths and the disabilities. Along with that, protects the family, co-workers and the society as well. What can we do from our end and to just maintain this is to have a vaccine record review, to encourage others surrounded by us to also get vaccinated, and always stay updated and informed regarding what is happening regarding the vaccinations. So that eventually will help us in decreasing the number of deaths or any kind of disabilities. Thank you.
Thank you very much, Dr. Supriya. Well explained about the adult vaccination schedule. And coming to the vaccine, as you all know that live vaccine and killed vaccine we have. So live vaccine contains, it's a weakened form of the live virus or the bacteria. So there are some, say for example, like tuberculosis vaccine and yellow fever vaccine, measles, mumps, rubella, cholera vaccine, typhoid and varicella zoster. All these things comes under the live vaccine. Coming to the killed vaccine, killed or inactivated virus vaccines, they are like again typhoid, cholera and injectable form of the polio virus, Japanese encephalitis vaccine, tick-borne encephalitis vaccines and hepatitis A virus vaccine, even COVID-19 vaccines. So these are comes under the killed virus category. And there are certain toxides or antitoxics, that is diphtheria, tetanus, anthrax. All these things are the examples of the toxoid vaccines, and of course mucopolysaccharide vaccines and glycoconjugate vaccines and recombinant DNA vaccines also she has already explained. So this is the main basic outline of the vaccination. But adults, who are the eligible adults to take the vaccines, especially adults with hypertension, diabetes, a smoker, alcoholic, obese, hyperlipidemia, and adults with chronic diseases, chronic comorbid conditions like asthma, COPD, and some heart diseases and kidney failure, liver failure, collagen vascular diseases, connective tissue disorders, amyloidosis, and sarcoidosis, and patient with cancer and patient who are on long-standing steroid usage. So these are the patients who are main eligible for to give the adult vaccination. So I request all the consultants, so kindly look into this matter, and most of the preventable diseases can be taken care by giving the adult vaccination. So this is about the today's topic, and thank you very much once again. And now I request Dr. Jagadish to conclude with vote of thanks. And before that, any questions from audience?
Just I want to know regarding COVID immunization. Okay, last we have taken all the booster doses, all the things. Okay, being a health worker, this time you are also seeing some COVID cases rising. What is the actually guidelines says, whether you will take COVID booster or and so there is confusion. Lot of vaccines are there, Indian vaccine, Western vaccine. Okay, what is the guidelines?
Being it COVID or non-COVID, it comes out to be COVID positive. RT-PCR, any virus can be detected. It is very simple. Any virus that has been detected on RT-PCR cannot be COVID is the first thing. If it for the COVID positive cases that are saying, the many studies in the recent times stating that even upon taking up the booster doses, it eventually causing the complications. Number of doses, increasing in number of doses will eventually not justify the complications that have been coming up for. As in like the thrombosis part in case of cardiac cases, number of booster doses in COVID will be eventually increasing the cardiac cases is something the study that have recently come upon. So justifying the saying of increasing, taking up for the booster dose every year in case of COVID is not recommended as per the guidelines, sir.
Even you had taken the booster doses, why people are getting affected with COVID again is what he was asking. Now the whole point. Is it right?
Asking whether need to take again.
No. The guidelines say that there is no recommendation to take any booster doses. Having said that, as Madam clearly told
Complications are there.
complications, fair enough complications, including neurological, everything, all complications have been there. But the whole point is, your immunization is only limited for 6 months of time. It cannot be extended more than 6 months. So you can become positive even if you have taken vaccine, if you had been reinfected with COVID after 6 months of your immunization is done.
Okay. So vaccine booster dose is for 6 months only.
Even if you have taken the booster doses, the titers should match with your, you need to have good titers so that you will not be affected again. You have to check your titer level, so then you have to take a call.
I think it depends on individual body tendency. Just like your angio, once you do angio, it will valid for 6 months. After that, there is no guarantee that patient will develop again heart attack or not.
First of all, thanks to our Director Harini Madam to support us, and internal medicine, regarding internal medicine, and Dr. Haricharan sir, we're thankful to do these all CMEs, and future we'll plan regarding these all CMEs in each and every department. So we need all the consultant support to establish these all things. Thank you.
Today at Prathima Kachiguda unit, as a part of continuous medical education program, we have organized a program on immunization, adult immunization. Our senior consultant, Dr. Haricharan sir and Dr. Supriya have taken this program, and adult immunization is very important nowadays because if you take immunization, we can prevent a lot of diseases. Not just child immunization, adult immunization should also create. We wanted to create more awareness on that. So as a part of it, we have conducted this seminar.
నా పేరు డాక్టర్ హరిచరణ్, సీనియర్ కన్సల్టెంట్ ఫిజిషియన్, డయాబెటాలజిస్ట్, లిపిడాలజిస్ట్, హెచ్ఓడి డిపార్ట్మెంట్ ఆఫ్ మెడిసిన్, అకాడమిక్స్ అండ్ మెడికల్ సర్వీసెస్, ప్రతిమ గ్రూప్ ఆఫ్ హాస్పిటల్స్. ఈరోజు ప్రతిమ హాస్పిటల్ కాచిగూడ యూనిట్లో అడల్ట్ ఇమ్యునైజేషన్ మీద అవగాహన సదస్సు నిర్వహించడం జరిగింది. దీనికి ముఖ్య అతిథులుగా మా యొక్క ప్రతిమ గ్రూప్ ఆఫ్ హాస్పిటల్స్ డైరెక్టర్ డాక్టర్ హరిణి గారు వచ్చి ఈ యొక్క CMEని ప్రారంభించడం జరిగింది. ఇందులో ఈరోజు మా యొక్క ఇన్హౌస్ కన్సల్టెంట్స్తో పాటు చుట్టుపక్కల ఉన్న ప్రాక్టీషనర్స్ ఫ్రమ్ నర్సింగ్ హోమ్స్, కార్పొరేట్ హాస్పిటల్స్, అందరు డాక్టర్స్ వచ్చి ఈ యొక్క CMEలో ఉత్సాహంగా పాల్గొనడం జరిగింది. ఈ సందర్భంగా నేను హైదరాబాద్ ప్రజలకు మరియు తెలంగాణ మరియు తెలుగు మాట్లాడే ప్రజలందరికీ తెలియజేసేది ఏంటంటే, ఇంతవరకు మీకు చిన్నపిల్లలకు వ్యాక్సిన్ ఇవ్వడం దాని మీద అవగాహన ఉంది. బట్ అడల్ట్స్ కూడా వ్యాక్సినేషన్ తీసుకోవాలి. 18 సంవత్సరాలు పైబడిన ప్రతి ఒక్కరూ వ్యాక్సినేషన్ తీసుకోవాలి. ఎవరు తీసుకోవాలి ఈ వ్యాక్సిన్స్ అంటే, ముఖ్యంగా బీపీ, షుగర్, ఆల్కహాల్స్, స్మోకర్స్, ప్లస్ క్రానిక్ డిసీజ్ అంటే దీర్ఘకాలికంగా సమస్యలతో బాధపడుతున్న వాళ్ళు, కిడ్నీ సమస్య ఉండొచ్చు, హార్ట్ ప్రాబ్లం ఉండొచ్చు, లివర్ ప్రాబ్లం ఉండొచ్చు, అదే కాకుండా ఆస్మా, COPD, స్టీరాయిడ్ వాడేవాళ్ళు కానీ, క్యాన్సర్ పేషెంట్స్ కానీ, వీళ్ళందరూ అడల్ట్ వ్యాక్సినేషన్ అనేది తీసుకోవాలి. ఇవి ఎట్లా తీసుకోవాలి, ఏ డిసీజ్ ఉన్నవాళ్ళు ఏ వ్యాక్సిన్ తీసుకోవాలి, ఎన్ని డోసెస్ తీసుకోవాలి, బూస్టర్ ఎప్పుడు తీసుకోవాలి, ఒక వ్యాక్సిన్ టు మరొక వ్యాక్సిన్ మధ్య ఎంత గ్యాప్ ఉండాలి అనే దాని మీద మీరు ప్రతిమ హాస్పిటల్ కాచిగూడ యూనిట్లో సంప్రదిస్తే మా డాక్టర్స్ ఇక్కడ వీటి మీద మీకు పూర్తి సలహాలు, సూచనలు ఇస్తారు. ఇదే సందర్భంగా నేను ఈ కార్పొరేట్ యాజమాన్యాలకు మరియు మా డాక్టర్ ఫ్రాటర్నిటీ అందరికీ విన్నపించేది ఏంటంటే, ఎంతసేపటికి ఆరోగ్య సర్వీసులను బిజినెస్తో లింకప్ చేయకుండా ఇలాంటి ప్రతిమ హాస్పిటల్ ఈరోజు నిర్వహించిన ఇలాంటి అవగాహన సదస్సులు అందరూ ముందుకొచ్చి ఇలాంటి సదస్సులు మీరు అవగాహన సదస్సులు నిర్వహించి అవేర్నెస్ క్రియేట్ చేయడంతో పాటు కొంత ఉచితంగా కూడా మెడికల్ సర్వీసెస్ను ప్రజలకు అందుబాటులో ఉండే విధంగా చేయాలని చెప్పేసి ఈ సందర్భంగా నేను తెలియజేస్తున్నాను.
Pediatrician and senior doctor in this locality. I am running the nursing home and the clinic morning and evening. So today, Prathima Hospital people have taken a very good step by conducting the adult immunization. Nowadays, everybody is worried about their children. They are not worried about adult people. So this is a very good lesson that we got now today. Every human being came to know that adult immunization is there. Some doctors, you ask old doctors, they don't know about adult immunization. That is new for them. So it is very good. This type of camps కానీ CME ప్రోగ్రామ్స్ కండక్ట్ చేయాలని నేను కోరుకుంటున్నాను. అందులో ప్రతిమ హాస్పిటల్ ఈ లొకేషన్ చాలా ఫేమస్ హాస్పిటల్ ఇది. ఇక్కడ ఆల్ సర్వీసెస్, గైనకాలజీ కానివ్వండి, పీడియాట్రిక్స్ కానివ్వండి, సర్జరీ కానివ్వండి, ఆల్ సర్వీస్ ఆర్ టేకెన్ వెల్ టేకెన్. patient care is number one here. The patient once admits and discharge చేస్తారు కూడా చాలా మంచి కేరు అంతా తీసుకుంటారు. వెరీ గుడ్ సర్వీసెస్ గెటింగ్ విత్ ఇది కామన్ పీపుల్కి కూడా ఇక్కడ అందుబాటులో ఉంది. కాస్ట్లీ హాస్పిటల్ అని చెప్పి చాలామంది అనుకుంటారు. ఇది కాస్ట్లీ హాస్పిటల్ కానే కాదు, కామన్ పీపుల్కి ఈవెన్ ఐ కెన్ సే రిక్షా తొక్కే వాళ్ళకి కానివ్వండి, లేకపోతే అక్కడ నుంచి హై పీపుల్ ఆల్ లోవర్ లెవెల్ టు హై లెవెల్, everybody can get a good type of treatment in Prathima Hospital.